Hi, I'm Dorian Traube, and I'm here today to talk to you about evidence-based practice in the field of social work. This topic has become very, very important to the field of social work over the last 10 years, and that's happened mainly because there have been a number of reports produced by the federal government and larger governmental organizations that point to the need for evidence-based practice in the field of social work. For your own edification, you can check out these reports on your own time. They include the President's New Freedom Commission report on mental health, the World Health Organization's report on mental health, and the Surgeon General's report of mental health. These reports are very important to the field of social work because social workers actually provide the majority of mental health services in the United States. There are approximately double the amount of social workers providing clinical mental health services when compared to clinical psychologists. What is alarming to those of us in the field of social work is that when we did a survey of programs in social work, very few are teaching evidence-supported therapies. Now, this is where I want to explain a very common misconception in our field. There are two terms we regularly refer to. The first is evidence-based practice, which is what I am going to cover today. There are also things called evidence-supported therapies. Evidence-supported therapies are treatments that have been tested widely in national settings to make sure that they are appropriate for different types of diagnoses and different populations. Both are important. However, our focus is on a general form of practice that we hope all social workers will use that draws from the research literature and clinical expertise to make sure that you are providing the most appropriate form of treatment for your clients. Many people will ask, well, I'm not really interested in providing mental health care, so why is evidence-based practice important to my form of social work? Well, I believe that mental health is just the tip of the iceberg in terms of pushing for evidence-based practice in the field of social work. And we will find that evidence-based practice goes into many other forms of social work that social workers provide on a daily basis, including case management, community organizing, and the various things that you will learn throughout the course of this MSW program. Now, the reason that we've had such a difficult time translating and implementing evidence-based practice into the field of social work is that there's about a 15 to 20-year delay between innovation in practice and actual implementation. Part of this is related to the fact that until now there's been a disconnect between the way that we license folks to practice social work, the experiences they receive, the training, and the policy and current research evidence in the field. However, we're hoping to correct that. There are four basic barriers we've encountered to implementation of evidence-based practice. The first one is knowledge. What do you know about evidence-based practice? There is a lack of awareness about evidence-based practice, and there's also difficulty in understanding what evidence is in research findings. And today is just the first day of your education in that area. There's also a theme of lack of fit among evidence-based practice and the practitioners who need to practice it. Many practitioners feel that it's a cookbook approach, that they are going to be handed an evidence-based practice and they're going to be told that they need to do this for every single client that they have. And what you will see today is, in fact, that's the exact opposite of evidence-based practice. In addition, some people feel that evidence-based practice is too broad, that it doesn't take into account the needs of the culture of the client, that it isn't always applicable to the setting in which the person is practicing, and that sometimes it's not in sync with current policy and technology. Some folks are also simply suspicious of evidence-based practice. It's a newer technique that we're using. Some folks feel that it's politically motivated, that we're doing it to cut costs, that it's not determined by the client's best interest, that it's guided by researchers rather than objective examination of the evidence, that it excludes the practitioner's professional judgment and clinical expertise, and it's designed only to set trends for further research reputation, and that you can find evidence in everything. And finally, there are resource barriers. Evidence-based practice can be a costly endeavor because it requires training, materials, time, and staff, and that it also requires technology and access to computers and the internet. And in addition, there have generally been some poor and inconsistent findings around the use of evidence-based practice in social work agencies. Today, what I will do is talk to you about how these 4 barriers to implementing evidence-based practice are actually myths and easy to overcome. First, I'm going to introduce you to what evidence-based practice is. Evidence-based practice is a combination of 4 areas: the clinical state and circumstances, the client's preferences and actions, research evidence, and clinical expertise. And at the center of those 4 areas are evidence-based practices. So you'll see that there is room for everybody's concerns and ideas to be accounted for. There are 5 steps to implementing evidence-based practice. The first is to, of course, do a thorough assessment on your client and convert the information you get from your client into the information you need to find out about evidence-based practices for your clients. So that includes finding out what kind of prevention efforts they may need, what assessments they need, what kind of treatments and what kind of risk factors they have, and converting that into an answerable question that you can enter into a search engine or a database. You're going to go into step 2 then by converting that information into a question and typing it into a database to track down the best evidence. And you will retrieve probably lots of information that you will need to wade through and critically appraise the evidence. The ability to critically appraise evidence is something that you will gather throughout the course of your MSW education, particularly in your research courses. And then you will integrate that critical appraisal into your own practice experience, what you have seen work with your clients. You will also gauge your clients' strengths, their values, and their circumstances, which are the basis of ethical and moral social work practice, and combine them with what you've learned from the research. And from that, you will then evaluate the effectiveness and efficiency of what you've done in terms of steps 1 through 4, to seek ways to improve your evidence-based practice the next time. That said, there is a cycle of evidence-based practice, taking into account those 4 areas that I covered before: clinical state and circumstances, clinical expertise, the current best evidence, and clients' preferences and actions. And in each of those areas, you're going to ask yourself, is this appropriate for my client? Are there any risks to doing this kind of treatment? Can I get in trouble with my agency? Does my agency support this kind of treatment? Does my client support it, and am I skilled to do it? Are there other ways to assess this client and to find effective services? What are the barriers for my client in receiving this kind of service? And does my client prefer to have this kind of treatment? And in what context can I provide this treatment for my client? Sometimes that requires referring to other agencies or getting extra training yourself. Now, many people feel like they're doing evidence-based practice, but they're not sure. So here are some things you can ask yourself to make sure that you are, in fact, doing evidence-based practice. Is there an individualized assessment? Have you assessed the strengths, needs, values, and preferences of your client? Have you come up with a well-formulated question to make sure that when you type it into a database, you're retrieving accurate information? Have you done a well-executed search of the research literature and decided if it's applicable to your client? And have you considered the evidence together with the values and preferences of your client? The tide has shifted in our field, and we definitely are seeing a huge push for evidence-based practice. And that's because there are a number of arguments for why evidence-based practice is important. First of all, it enhances decision quality. It allows the practitioner to be sure that they are practicing efficaciously and on the cutting edge of technology. And it also enhances your client's ability to choose what's best for them. It fosters learning assessment skills because you are constantly assessing, and you can't rely simply on one form of assessment, but you need to use multiple forms. It certainly incorporates your client's values and expectations for their care. It fosters evidence search and appraisal skills. It makes use of the best evidence that we have in our field right now. It's a framework for self-directed and lifelong learning. It helps us identify the gaps that we have in our knowledge right now. And it's a common interdisciplinary language so that when we go out and work with allied professions, including psychology, psychiatry, and medicine, we can all speak the same language to one another and come together to best treat our clients. In addition, the use of evidence-based practice eschews the authoritarian practice and policies that we've sometimes seen in other forms of clinical treatment. It promotes transparency and honesty with our clients about what we know is best according to research, what they think is best according to their own experiences, and what we can realistically provide for them. It encourages a systematic approach to integrating practical, ethical, and evidentiary issues, and it maximizes the flow of knowledge and information about knowledge gaps in our field. Evidence-based practice is also a wonderful way to promote social work values and ethics. We can promote these by providing informed consent to our clients around evidence-based practices, by using effective services, wisely allocating sparse resources, involving clients in practice decisions, individualizing and personalizing the services that we can provide, helping clients to create a clinical appraisal themselves, which is a transferable skill that they can use outside of the treatment situation, involving clients in the design and critique of practice and policy-related research, involving clients and informed participants who share in decision-making, and recognizing clients' unique knowledge in terms of the applications of their concerns. This is just the first day, as I've said many times in your introduction to evidence-based social work, and as you progress through your education, I want you to be aware of some difficulties and challenges facing the use of evidence-based social work that you will continue to try to overcome as you practice social work. The first is evidence of effectiveness. There are lots of ways to assess effectiveness, and so that is one thing that we are constantly working on as a field. How do we assess evidence of effectiveness? You will learn more about this throughout your coursework. There are also challenges around issues of authority and who has the authority to say something has evidence. There's a conflicting hierarchy of evidence in terms of, is research evidence more important than client preference? There's a problem around the definition of evidence, and there's a shortage of evidence. There's variations in fields of practice. Perhaps there's more evidence in the field of mental health versus the field of families and children. Sometimes people inflate the evidence that they found, or they only find small effects, but they think that they might be noteworthy. And sometimes people misassess their clients and the situation. There's issues around efficacy versus effectiveness. Efficacy is what we find when we work in clinical research settings, including laboratories. Effectiveness is what we find in the real world. And one of the biggest challenges that we face is making sure that the interventions that are tested at universities and research settings are applicable in the real world. One of our biggest challenges is that 15 to 20-year lag between finding something that's effective and actually implementing it in the field. Sometimes our policies and systems don't support the use of evidence-based practice, and most of all, we need to continue to train and sustain around the area of evidence-based practice. So I encourage you to begin to learn this process, apply it for your clients, and use it throughout the course of your career, as this is the new method of social work. Thank you all so much for joining me today. I hope you found this brief discussion of evidence-based practice interesting, and I hope it sparks some more interest for you throughout your career.